There is some new data out showing us what a lot of us have already speculated, that Trump counties are being hit much harder by COVID-19 compared to Biden counties. And that, of course, it all comes down to the vaccination rates. And as I'll show you later, this experience is also being mirrored in Canada, where our conservative regions are also being hit harder by COVID-19 due to the lack of vaccinations. So I have several graphs here to show you and break this down. First, let's start with this. So this is put together by the New York Times. They show here vaccination rates and 2020 U.S. election vote shares. So you see here, it is very clear. On the left side of the screen, you have the larger vote share for Biden, meaning there is less people here are unvaccinated. And on the right side, larger vote share for Trump, and a larger portion of residents are unvaccinated. So it is very clear. The blue states on the left, largely vaccinated. Red states on the right, much less vaccinated. And of course, that translates into the result with COVID. So COVID deaths and 2020 U.S. election vote shares. You see here, once again, on the left, larger share vote for Biden also equates to less COVID deaths, and a larger vote share for Trump on the right equates to a larger share of deaths. And breaking this down even further, you see here average daily COVID deaths in the U.S., counties with large Trump vote shares compared to large Biden vote shares. It is just completely night and day, especially when it applies to the COVID or the Delta variant being a lot more contagious. So you have these large unvaccinated pockets in these Trump counties, meaning much larger spread of COVID-19 among the unvaccinated in those counties. Now, breaking down the data here, New York Times writes, some left-leaning communities, like many suburbs of New York and San Francisco and Washington, as well as much of New England, have such high vaccination rates that even the unvaccinated are partly protected by the low number of cases. Conservative communities, on the other hand, have been walloped by the highly contagious Delta variant. Since Delta began circulating widely in the U.S., COVID has exacted a horrific death toll on Red America. In counties where Donald Trump received at least 70% of the vote, the virus has killed about 47 out of every 100,000 people since the end of June, according to Charles Gaba, a healthcare analyst. In counties where Trump won less than 32% of the vote, the number is about 10 out of 100,000. So 47 out of 100,000 in Trump counties versus 10 deaths out of 100,000 in Biden-leaning counties. It all comes down to the vaccination. And this continued desire to want to view this issue as political, as opposed to looking at the science and the data and the facts. If you want to call it political to get a life-saving vaccine, then by all means, call that political. But clearly, the more vaccinated these counties are, the less of a chance there is for individuals in those counties to end up in the hospital and die from COVID-19. And showing you just a couple of anecdotes here in terms of the impact of this. You have Kyle Griffin tweeting out here, Idaho morgues are running out of space for bodies as COVID deaths mount. Some morticians have even started embalming bodies that wouldn't normally need the procedure so they don't have to refrigerate them. So a lack of space here for deaths from these people dying from COVID-19. There's a lack of space in these morgues. And Idaho, of course, a big Trump state. So you see the result there. Another example from in these times, rural areas struggle to compete for nurses as they face dire shortages. COVID has overwhelmed hospitals, prompting many overburdened nurses to change careers or retire early. The shortages have hit rural areas particularly hard. So, of course, rural areas, more red, conservative, less vaccinated, COVID-19 hitting those areas harder. And because of that, you have a shortage of nurses due to the immense pressure and stress they are under during this pandemic, particularly in these counties where there are more unvaccinated people ending up in the hospital. Now, a couple last things here, as this also is a similar experience in Canada. So Robson Fletcher here, data analyst for CBC, tweets out people in Alberta and Saskatchewan are dying from COVID-19 at about quadruple the rate as people in the rest of Canada. Looking at the graph here, it is crazy. So you have Alberta, Saskatchewan, more conservative provinces here compared to the rest of Canada. It's not even close. So it's, again, the unvaccinated, the idea that the vaccines are, I don't know, going to hurt you more than COVID-19 will, whatever the conspiracies are propagating. You have this idea spread throughout mostly conservative communities. Not only, there are people that would consider themselves to be more on the left that are also skeptical of the vaccines for whatever reason. But largely here you see conservative counties, provinces, regions being impacted by COVID-19 because they are not getting the vaccine. And one result of that here, David Fishman tweets out, around half of Canada's COVID-19 cases over the weekend were reported in Alberta, which has 10% of the country's population. So half the cases with only 10% of the population of the country. I don't know what else you need to see. Like, I unfortunately, most people that watch these videos are, unfortunately or fortunately, already agree with this, already understand that this is the result of being unvaccinated. You are greatly exposing yourself to COVID-19, especially with the Delta variant. But in terms of, that minority of audience that doesn't yet have the vaccine, what more do you have to see? How many more stories do you have to hear of people regretting not getting vaccinated once they're in the hospital? How many radio hosts, AM radio hosts that propagated anti-vax conspiracy theories ended up dying from COVID-19? I mean, you're seeing this every single day. And now we have the data to back it up, showing you that conservative, unvaccinated regions are the ones being hit by COVID-19 the most. All you have to do is get the vaccine. This is how you eliminate a virus, especially when it comes to the variants. When you leave more space for variants to evolve, to change, to grow, you then leave the potential for those variants to form or for the virus to form a new variant that could render the current vaccines less effective. This is why the need to vaccinate is a communal thing, why we all have to do our part. It isn't just for ourselves, it's for our community, it's for the country, it's for the world to get vaccinated and eliminate this virus.